Hi there. So today is November 12th, 2023, and since we're recording this, I'm just going to use your patient ID. So you are patient number 22574, 28-year-old female, and your chief concern is that you're still getting cavities despite brushing daily and flossing a few times a week. So you're presenting for nutritional counseling, and I just want to thank you for taking part of this 5-day diet diary. So to start, I reviewed your medical history and I didn't see any major health conditions or medications that would affect you getting cavities. But since we were brainstorming the cause of your problem, if you remember, we discussed your diet, which is why I asked you to participate in completing a diet diary. So we can look to see if your diet is adequate and what is maybe causing these cavities. So some of the things that I noted from our previous interview is and this is all the stuff that can affect this situation, is that you worked remotely from home. You just recently had a child. You've seen a downgrade in your diet since your pregnancy. You've stopped drinking alcohol. You've been craving more unhealthy foods. You don't have very good willpower over your choices in foods. You've tried dieting, but couldn't make it stick. You snack and sip more often than eating full meals and drinks in one sitting. And you're brushing once a day in the mornings and flossing a few times a week. So these can all have an effect on your diet and can also affect your oral health. For example, I'll go through all these points again. You said you worked remotely from home. So it's a lot easier to have a less than adequate diet when you're working from home. It's really easy to go in the fridge to get, the foods that you want to eat, to frequently snack. You don't have anybody over your shoulder, wanting you to work instead of eat. It's just easier to not be as good with your diet when you're working from home. You also said you just recently had a child, and so pregnancy hormones can definitely affect the way that your diet affects your systemic and oral health. Your hormones are different than when you're not pregnant, and it's just, it can be a little bit unpredictable, but for the most part, you are going to see effects in your oral health due to pregnancy. You said you've seen a downgrade in your diet since your pregnancy. Again, it's really easy, kind of like working from home. It's really easy when you're pregnant, when you don't have as much energy to lounge, to eat what you'd like, to snack, feeding that baby you are growing in your stomach. It is really easy to have that affect your diet, which in turn can affect getting cavities, what's happening in your mouth. So you said you've also stopped drinking alcohol. Now, this is something that I don't think a lot of people realize, but alcohol is mostly sugars. So when you stop drinking, and even if you're not a problem drinker, if you just drink on the weekends or have a glass or two of wine at nights and stuff, when you do stop that, your body craves that sugar, especially if you stop cold turkey, and it'll look for that sugar somewhere else. You'll start craving other things, carbohydrates, sugars, things that are definitely not what you want to be eating, but it's something you're craving because you removed the sugar intake you're getting from alcohol. And this can, again, affect your oral health when you're eating and drinking more sugars. You said you don't have very good willpower over your choices in foods. You've tried dieting but couldn't stick with it. And this is definitely something, again, that's going to affect your forming of cavities, eating a less than adequate diet, not having very good willpower. I definitely don't recommend dieting. I do recommend forming better habits, forming things over time. It's just a lot healthier. It's easier to stick with. So, but this again, the diet can affect your oral health. You said you snack and sip more often than eating full meals and drinks in one sitting. Now, this is another big one that people don't realize, is that the frequency of eating the sugars and carbohydrates is way more important to pay attention to than how much you're eating or drinking of those sugars and carbohydrates. It's it does matter how long those things are sitting on your teeth. What is happening is the bacteria is eating those sugars and carbohydrates and excreting acids, basically, that are going to be eating holes in your teeth, and that's what causes cavities. Once those holes get big enough, it's considered a cavity. Now, there is something called demineralization, which you do have quite a bit of on your gingival margin, your gum line, and when you see that, it just means that you are accumulating plaque and it's sitting on that gum line and it's kind of eating away along your gum line. It's not quite cavities yet, it's white, and I actually do have a picture of demineralization. It looks like that. You can definitely see the white along the gum line, which is the kind of the starts of cavities. And then you also said you are brushing once a day in the morning and flossing a few times a week. I definitely recommend, if you can only if you can only brush once a day, to brush at night. You want to make sure that you're brushing off all those sugars in your mouth at the end of the night, so that you're not sleeping for 6 to 8 hours with that stuff on your teeth. So being able to, changing that habit can definitely help you. And then flossing, of course, you do have a little cavities in between your teeth. And even though you're flossing a few times a week, obviously, that's something that we need to either improve or find a better method to do that. So I also did an extraoral, intraoral assessment on you. So that is when I was looking around at your face, feeling your lymph nodes, checking for any abnormalities, lumps, bumps, bruises, anything like that. And then we kind of did the same thing in your mouth. So some things that I noticed is that you had some acne and rosacea around your face. You had demineralization, which is the white spots I just showed you, along your gum line, and small cavities in between your teeth. Your gums are inflamed and bleed when being probed or flossed. This can all be signs of deficiencies in your diet, as well as possible inadequate home care. The acne and rosacea can mean that, your diet is affecting your skin. We can definitely look at that and see that there is some sort of effect going on when we see that rosacea or acne on your face. Having demineralization, those white spots on your teeth, I just explained how that happens. Having more plaque on your gum line and having it affect your teeth, causing small cavities, and then having your gums inflamed and bleeding when we're probing or when you're flossing. That is a big indicator that you have plaque and acid sitting on your gum line, because not only does it affect your teeth, but it's affecting your gums as well. If it can cause holes in your teeth, imagine what it is doing to your gums. So when your gums are inflamed like that, it just means they're sick. There's plaque sitting right along your gums, and it's hurting your gums. So when we're looking for health, we're looking for the lack of bleeding. The bleeding means that your gums are sick. There shouldn't be any bleeding when you're flossing. But it is good that you're doing it a few times a week. That's definitely more than a lot of people. So the rationale for this 5-day dietary analysis, or for you, the diet diary, is to locate and identify any deficiencies in your diet that might affect your oral health and cause cavities you've been getting. So I wanted to start with your caries classification. So caries just means cavities, and what I'm talking about is there's 3 categories. There's a low risk, a moderate risk, and a high risk. And I do have our caries assessment form here. Oh, upside down. And so it just has categories, and depending on the answer of these categories, it puts you in either low risk, moderate risk, or high risk. Whatever is our highest category is kind of where you are, and this can be up to whoever is grading the person. There are exceptions. Even if you have one high risk category, it could be something that is permanent, and even though you're now in health, it's just still there. Old restorations, those kinds of things. So it can definitely, you might have one in the higher risk, but everything else in moderate risk, and then we would choose the moderate risk, since that one higher risk is something that you can't control, but you're doing well regardless. So for here, the only ones I saw that that pertain to you are the fluoride exposure, which you use fluoride toothpaste, so you're getting that, which would put you in low risk. Sugary or starchy foods or drinks, that would put you in a high risk, but I don't think your diet is bad enough to put you in that category. Your sugar intake is definitely higher than we'd like it to be, but it's not exceptionally high. Let's see here. We don't have any smokeless tobacco use, no medications that reduce salivary flow. You do have cavitation or non-cavitation, which is cavities. And depending on how many you actually have, since I cannot diagnose, it would either put you at a moderate or high risk. Visible plaque, it puts you at moderate. And then, let's see, I believe that is it as far as what pertains to you. So if I were to be grading you, I would actually put you at a higher risk for the visible plaque and the small cavities. It's just, and that's something that can be improved. It's not something that is going to stay like that forever. So, and which is why we're doing this diet analysis. We can pinpoint what needs to be improved, what needs to change, working on bettering our habits.